Well, we're about to go on a very interesting journey through our gastrointestinal tract. It's a fascinating journey and it's a very misunderstood journey. And Proverbs 14 verse 6 says, "Knowledge is easy to him that understand." So my aim is to give you an understanding of your gastrointestinal tract, and then you will know, or you will have the knowledge on how to treat it. So we begin with the mouth. Now, the mouth is the only area in the whole of our gastrointestinal tract that we have a say over. And the choices we make in the mouth, as you will see, affect the whole of our gastrointestinal tract all the way down. So 5 choices we have. Number 1, we choose what goes in. Is it fast, devitalised food, or is it organic food prepared in the most healthful manner? We choose. Second, we choose how long it stays in the mouth. Is it chew, chew, swallow, chew, chew, swallow, chew, chew, swallow, or is it chew, 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 until it is well broken down? You've probably heard the old saying, we should drink our food and chew our drinks. What do I mean by that? Tomorrow we're going to be looking at the liver and we're going to be looking at detoxification, and I'm going to describe the detox program that our guests go through, and they have juices for 2 days. And when we serve the juices, we say, don't forget to chew your juice. So a mouthful and then swish, 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 warm it, mix it with the digestive enzymes, swallow. So that's what we mean by chewing our drinks. And if you get some very cold water, it's nice to keep it in your mouth a little bit to warm it, ready for the stomach. And a lot of people like drinking ice water in the summer. Actually, it warms their body because the body has to create heat to warm that freezing cold water before it can let it go out of the gut and into the blood, into the body. So we choose what goes in, we choose how long it stays in the mouth, and number 3, we choose how much goes in. Is it 3 platefuls of food, 6 platefuls of food, 1 plateful of food? And as you will see, the stomach can only digest so much food. So when we overload it, we can really delay digestion. We also choose how often the food goes in. Is it every hour? Is it every 2 hours? Or are we leaving a nice 5 to 6 hours between the meals? And the 5th one, the last one, is we choose the environment of entry. And I love the saying from an old book, we should cast off care and anxious thought when we sit to dine. If we're eating in a stressful environment, it inhibits the release of our gastric enzymes. So if you're stressed and hurried and you're very hungry, you know what you're better to do? Have a smoothie, have a vegetable juice, have a soup, have something very light. If you're very stressed, don't sit down to a large meal. And also, at the table, please no controversial issues discussed at the table. Peaceful environment at the table. That ensures and helps better digestion. So they're the 5 things, they're the 5 choices we make. So let's have a look at the mouth. The mouth is a alkaline environment, and I think it's on Friday we look at bones and the acid-alkaline balance in the body. And we will see that the body as a whole is and should be an alkaline environment except for the stomach. So the pH environment in the mouth, the acid-alkaline, is alkaline. And there are 2 enzymes that are released in the mouth. So these two enzymes begin digestion. One is lingual lipase. And lingual lipase is an enzyme that is released, we'll just put L lingual lipase. It's released from the sublingual glands under the tongue, and lingual lipase breaks down saturated fat. Now, this morning, when we touched on fat, I mentioned that saturated fat is actually quite a remarkable fat. It is the only fat whose breakdown begins in the mouth. All the other fats, their breakdown starts further down. So what's a saturated fat? Ghee, butter, coconut oil, palm oil. There's a percentage of saturated fat in macadamias. There's a percentage of saturated fat in avocado. A lot of nuts and seeds are a combination of various different types of fats. But they're the main sources of saturated fat, and the breakdown begins in the mouth. Another food that's breakdown begins in the mouth is starch. Starch really is another name for carbohydrates, but it just fits better into that section. So today we call it carbohydrates or carbs, and probably an older term for it is starches. So that's pastas, breads, cereals, all your carbohydrates. And the starch is broken down under the action of a salivary amylase called ptyalin. Ptyalin is the salivary amylase that begins starch digestion. That's why it's very important to chew your bread and your cereals and your rice very, very well, because the breakdown begins in the mouth. Now, when it gets into the stomach, it basically stops. Probably stops within about 10 minutes of getting into the stomach, because the stomach is an acid environment. So the longer you keep those starches in your mouth, the more digestion is initiated. But just a comment on ptyalin. Ptyalin is not present in very big amounts until the molars come through in a baby, because babies don't need ptyalin because they're not eating starch. And breast milk is quite low in starch. So only very small amounts of ptyalin are released within a baby's mouth. And it is not until the molars come through. See, the first teeth that a baby gets is 4 at the top and 4 at the bottom. And they're called milk teeth. And you know why they're traditionally called milk teeth? Because that's what should be baby's main food, is milk. And they come through maybe about 7 months, usually coming through till about 14 months. A bit of a variation with some babies. And then between 14 and 22 months of age, then the molars come through. And the molars are back here. Molars have 4 cusps. Molars are grinders. What do we grind? Grain. Then, and only then, are serious amounts of ptyalin released. So do you know what that means? Babies should not be given starch. Now, do you remember that psalm I gave you this morning? Psalm 146, verse 3, put not your trust in princes. Who are the princes? The authorities in the field. What are the authorities in the field telling mothers to give their babies between 4 and 6 months of age? Cereal, rice cereal, what's that? Pure starch. So why are they doing that if there's no ptyalin in serious amounts until the molars are through? Well, what they say to a mother is, you must, because breast milk does not have enough iron in it in the second 6 months. You've heard that? Well, let's have a look at this. How much does a baby grow in that first 6 months? Explosion. How much do they grow in the second 6 months? And they're still growing, but not quite the explosion. In other words, their need for iron in the first 6 months is greater than their need in the second 6 months. And I ask you, has God made a mistake? God never makes mistakes. In fact, that's one of the beauties of breast milk. It is perfect for the baby at every single age. It's perfect. But what's happening is babies are getting starch when they don't even have the enzymes to break it down. And what this can do is this can set up malabsorption syndrome in the gut. Do you mean my gut problems maybe stemmed from way back then? As you will find out, even if we were fed starch as babies, the good news is once you start giving the gut the right conditions, it does recover. I heard this when my first baby was born in 1976, was only 3 months old. A friend of mine was working in the malabsorption syndrome ward in Camperdown Children's Hospital. That's the biggest children's hospital in Australia. He said this ward is full of babies who have been given starch too early. He knew. But many do not know that basic thing. And why do mothers give the cereal to their babies? Through fear. You know what they're told? Your baby won't develop. Your baby's brain won't develop. It's not true. It's not true. Let's go back a couple of 100 years ago. Babies were not fed food. Let's go back 1,000 years ago. Let's go back several thousand years ago. Do you know, let's look at some of the geniuses. Galileo, Einstein, Mozart, Bach. Do you know what this means? They weren't fed food. Did they suffer? They're the geniuses. So my son James is my second baby. He was not interested in food, and because I knew this, didn't bother me. In fact, how much easier is it, mothers, if you don't have to make baby food? So easy. So, sometimes at a meal he might chew on a bit of cucumber, but he didn't eat any food, so to speak, till he was 16 months of age. So he's this little boy running around, certainly not skinny, meeting all his milestones, and all he's eating is breast milk. Well, did it affect him? Let's look at James today. He's in his 40s now. He's a master builder, so he's a smart guy. He's an incredible artist. He's a musician, plays beautiful panpipes. Looks like a bodybuilder. He did not suffer. He did not suffer physically, mentally, in any way. He did not suffer. But no mother wants to put their child at risk. So unfortunately they do. And let me tell you something else that's actually a bit crazy, amusing in a way. When a baby sucks, they use their tongue and their top lip. And when that slop, so I can't call it anything else, that rice cereal is put in their mouth, they go like that. And what happens to it? It comes straight back out. And so I've seen mothers do it. They scoop it up, put it back in. The baby goes like this. That's all they know. They haven't got any teeth. Makes no sense at all. So a couple brought their little baby to me one day. And little baby's smiling there, 5 months old, and has 2 teeth. I could see by the smile. And I said, yes. They said, our baby's got constipation. I said, really? What does the baby eat? Oh, the baby's breastfed. I said, that's really good. Any food? Oh, yes. We give rice cereal for breakfast and all that baby be doing would be gumming. And the baby can't even sit yet. I don't know about you, but I'm not interested in lying down and getting slop fed into me. 3 things must be present. The baby can sit, the baby can feed themselves, and the baby has some teeth. Isn't that common sense? I said, I'd like to suggest that your baby has constipation because the baby's getting fed a food it can't digest. They were both gobsmacked. They'd never heard such a thing. I said, I'm looking at the size of your baby and your baby doesn't need anything else. It was one of those real chubba babies. They looked at each other and they changed immediately. And guess what? Constipation went away. You know, that's a sign. Something's wrong here if the baby suddenly stops going. So this is important information. My book there, Sustain Me, has a section, What Shall I Feed My Baby? Take a photograph of it, give it to every mother you know. You have it from the horse's mouth. We've got to start saving the nation through the gut. When the gut doesn't work well, I tell you what, the person's not a happy chappy. So please chew your starches. And then we come down. It's an amazing process, swallowing. We don't even think about swallowing, but swallowing closes the trachea and opens the esophagus, because the trachea goes down to our lungs and the esophagus goes down into our stomach. And that swallowing action is a muscular action, and then it causes the esophagus to start contracting, moving the food down, and that contraction causes this little valve here, it's a double-layered valve called the cardiac sphincter. As the esophagus contracts, it contracts and opens. When that little muscle is relaxed, it's closed. When it contracts, it's open and the food goes into here. And the stomach is the only part of our body that should be acid. I'll tell you an interesting story. I think it was in Little Rock. Jack and I went into the airport very early in the morning. There's no one around except a policeman with a very big gun. You don't never see this in Australia. It's about that big. And we went up to him and said, "We're not sure where to go." And he stood up, put his gun, beside him and took it with him. He said, "I'll show you." And as we're at the lift, he said to me, "You're Barbara O'Neill, aren't you?" I said, "Yes, I am." He said, He said, "I've had reflux for many years." And he said, "I was on Nexium." And what's Nexium? Nexium cuts the stomach acid, because the thought is the acid keeps coming up. Let's stop the acid. He said, "I watched one of your lectures and I discovered it was a scam." He said, "I stopped taking my drug that I'd been on for 8 years. He said, I started taking cayenne pepper to boost my hydrochloric acid. No more reflux." He said, "Thank you, and this is your gate." So I'll never forget that story. It's amazing the people that get touched by this incredible message. It's wonderful. Notice what he said, "I learnt it was a scam." Let me give you another illustration. Let's say you've got a lovely vegetable garden and the cows keep getting in and stomping all over it. So does the problem get fixed if you keep shooting the cows? No, just shut the gate. Just shut the gate. So by shooting the cows is the same thing you're doing by taking antacids. Don't shoot the cows. You need that acid. Just shut the gate. The gate is that little cardiac sphincter that sits here. Well, what would weaken it? Eating breakfast like a pauper, lunch like a pauper, and supper is the king and the queen together. How many people do that? I know in Australia a lot of people do that. Fast society, up too late at night, wake up, grab something light, a cup of coffee mid-morning, grab a quick bite for lunch, get home. Now I've got time to cook. And the appetite is huge because they haven't eaten much through the day. The best weight loss program is a program that prevents hunger. How do you prevent hunger? You eat breakfast like a king, you eat lunch like a queen, and then at night you don't have a lot of hunger, so you don't eat very much, if at all. That's the best way to lose weight, prevent hunger. That's how you prevent it. But one of the side effects of having breakfast like a pauper, lunch like a pauper, and the supper is the king and the queen together is when you lie down at night, that big mass in the stomach pushes against the cardiac sphincter and weakens it. It's not the odd day you have dinner with friends. And it's not the odd day you don't. It's what you do every day that has an effect. So that weakens the cardiac sphincter. Stress. When you're stressed, your muscles tighten and that little cardiac sphincter can open. And when it opens, it's a double-layered valve. God did a very good job to keep that acid in there. But if you're having most of your food at the end of the day, popping something in all day long, something little, stressed, that's what weakens it. Everyone that comes to us with reflux or heartburn goes home without it. Because at the retreat, we serve breakfast like a king and lunch like a queen. And we just serve a thin soup at night. And we also give magnesium. Magnesium is the ultimate muscle relaxant. So taking magnesium relaxes that little sphincter. And when it's relaxed, remember, it's closed. A magnesium citrate is the most absorbable, taken by mouth. Lining the stomach are big glands. Yeah, I think you call it citrate, we call it citrate. It's like we say tomato, you say tomato. We say aluminium and you say aluminum, is that right? All these different ways. So the lining of the stomach has big folds. That's so that when we eat our meal, it can stretch out. And 2/3 of these glands that line the stomach are made out, or they release, I should say, mucus. And mucus is 99% water. And that mucus protects the lining of the stomach from what's released here. And what's released here is hydrochloric acid. 1 drop of hydrochloric acid on your skin would burn a hole in your skin. So we've got this nice thick mucosa wall. What's also released from here is pepsinogen. And pepsinogen and hydrochloric acid unite and release pepsin. And pepsin is the enzyme that breaks down protein. That union will only happen in an acid environment. Pepsin only works in an acid environment. That's why if someone says to me, I've got a very acid stomach, I say, fantastic. You must be digesting your food very well. But then I say, how do you know it's acid? Well, it keeps coming up. Well, the problem's not the acid, the problem's the gate. Shut the gate. And by the way, that little gate, it's a muscle, and it sits right in the middle of our diaphragm. And our diaphragm is part of our abdominal muscles. So it's very important to keep the abdominal muscles strong. So if you go to the doctor with reflux, will he give you a little explanation on how important it is to keep your abdominal muscles strong? Which means we should be doing push-ups every day. And if you can't do push-ups on the floor, do them on the wall and then do them on a chair. But little by little, build up your abdominal muscles. You might only be able to do a few at first, but build them up to get that strong abdominal muscles. Another reason why we need strong abdominal muscles is because they're all connected to our spine. So it helps your spine to have strong abdominal muscles, but it also helps to strengthen that little cardiac sphincter that just sits at the top of the stomach. Because the acid's not the problem. And if someone says, but I can feel it burning me, and I said, well, maybe it's because you're dehydrated. When you have a glass of water half an hour before the meal, the first thing that water does is thicken this mucosa lining. So why would someone have low hydrochloric acid? I have never met anyone with too much hydrochloric acid, but I've met many with not enough. How do you know your hydrochloric acid is low? Well, it's 5 hours after the meal and you feel like you've just eaten the meal. Or bloating. It's not the only cause of bloating, but it is one of the signs, because if you had strong hydrochloric acid, it would chew through that food and move it on quickly. How can you boost your hydrochloric acid? Taking 1/3 of a teaspoon of cayenne pepper in a little water just before the meal. Just even in the mouth, the message is given to release more. 1/4 cup of hot ginger tea just before the meal. It boosts a release of hydrochloric acid. I was happy to see my friends from Living Springs here, and they sell a bitter tea that's talked about in my book. called digestive tea, and that has some bitter herbs in it. And we usually serve a quarter of a cup hot just before the meal, and that will cause a boost. Just the juice of a lemon before a meal, that can also boost your hydrochloric acid. And of course, at the same time, have breakfast like a king, lunch like a queen, and supper like a pauper, and leave breaks between the meals. What about children? Can children go that long between a meal? They can. I was in Andalusia, the northern part of southern Spain, last year, and I stayed in a beautiful stone house, 300-year-old stone house. And the family that lived in the house, they had 5 children. They had a 2-year-old and a 4-year-old and a 6-year-old and a 9-year-old. Must have been 4 children. Oh, and a baby. I think that was the 5th. Those children ate 2 meals a day. And they were incredible-looking children. They were bright. Their skin was brown because they were out in the sun half the day. They had white curly hair. They were happy children. They were active children. 2 meals a day. They had breakfast, I think, about 8:39. Then they had another meal about 2:33. Now, the little 2-year-old that you would think maybe would struggle going that long, right in the middle of the day, he's having his daytime nap. And so he wakes up just about when the meal happens. I raised my 6 children. And then when I married Michael 27 years ago, and he had 2 and I had 6, we raised all our children on just 2 meals a day. Now, if they go to school, it's a bit different. We were homeschooled, so we used to have our main meal 2 in the afternoon. Then it's easy, not to have anything at night. You basically have to do what works for you and your schedule in your day. But if you do 3 meals, the last meal should be the lightest meal of the day, because we're just going to bed. You don't need much at night. So looking after the stomach is vital to get a happy stomach and a stomach that's digesting your protein well. So pepsin is the enzyme that breaks down protein, and it needs a nice acid environment to be able to effectively break that protein down. Something else I didn't mention was B12. B12 is a puzzle to so many people, and a lot of people think you can only get B12 if you're a meat eater, but it's not true. Let me tell you the B12 story. B12 is bound up in food with an R protein. And when it gets into the stomach, hydrochloric acid releases the R protein from B12. But in those parietal glands in the stomach, intrinsic factors released. And so now we have got B12 and intrinsic factor, and they float together all the way down to the last part of the small intestine. Then intrinsic factor and B12 unite, and then they're absorbed into the enterohepatic circulation. Hepatic mean liver. So this circulatory system, the B12 stays in until we need it. So most people who are deficient in B12, it's because they're low in hydrochloric acid, and then you can't disconnect the R protein from the B12. And if that's not disconnected, it can't be absorbed. And if we've got low hydrochloric acid, we've got low pepsinogen, and we've got low intrinsic factor, and we need that intrinsic factor to absorb the B12. I hope I haven't lost you. So you can see meat eaters, vegetarians, vegans alike can all be low B12 deficient, but the cause will be insufficient digestion because of low hydrochloric acid. So we can boost our hydrochloric acid by the ways I just mentioned. So that's the B12 story. B12 is an airborne bacteria. So last week when we were at the strawberry farm and picked up a strawberry and ate it straight from the plant, we're getting B12 because it's an airborne bacteria. No, we didn't wash it and scrub it. Why would we do that? What are you washing off? Your gastrointestinal tract is a hollow tube. And anything that goes into that hollow tube is not part of you or me till it gets broken down to tiny substances, which we're halfway through the process. Then it gets absorbed into the blood. A lady said to me one day, she was so embarrassed. She said, I hate to tell you this, but I really need to know. She said, my 10-month-old baby was crawling on the grass and she ate some dog droppings. Oh, the mother was just beside herself. And I laughed. Maybe I shouldn't have laughed. I said, it's all right, it's just going to go in one end and come out the other. Because our gastrointestinal tube is a hollow tube. And nothing can get out of there and into the blood. There's a whole protection process there, protecting the blood from any harmful pathogens that might happen to come into the gut. She was greatly relieved, but of course we don't encourage such a thing, and we do look at the grass before we put our baby down. But I understand sometimes there can be something there we can't see. And you have a look at what babies eat. Have you seen it? They eat anything. My daughter Emma, she said one day she went in to get her little baby Daniel. She heard he'd woken up and he was about 12 months old. And he's standing on the cot, standing up at the cot, and the windowsill's there, and he's eating the ladybugs. And there was a dead, gummed-up ladybug on his cheek, and he's there smiling with bits of ladybug in his mouth. Anyway, I'm sure we've all got stories of babies do that. Actually, it's better for them than a candy. Because unfortunately, the candy is broken down so much that pure sugar can get out and into the bloodstream. But it's an illustration to show it's a hollow tube, this gastrointestinal tract. But you know what my question is? Well, if babies will eat anything... In fact, a friend of mine was minding a little toddler one day, a little two-year-old, and her brother was 5, and the brother brought in a few caterpillars. The next thing, she looked down and the caterpillars were gone. The 2-year-old had eaten them. So what makes a baby fussy? How come a 3-4-year-old are fussy? They'll only eat certain things. Well, if you give a little 2-3-year-old a chocolate and then give them an apple, they're actually not interested in the apple because they've just had something so sweet that the apple tastes bitter. So be careful what you're feeding them. In fact, I came to the conclusion that we adults dictate the tastes of children because we're the ones that give them the food. I notice my kids that eat anything. They'd eat salads, they'd eat all sorts of things that a lot of kids won't eat, but that's all they had. And you know, when they're hungry, you'll be surprised what they eat. And these five children, you know, in Andalusia, Spain, they're sitting down and they're just eating this big salad. How many kids eat salad? Not a lot of kids like salad. You know, they want, first of all, you know, and I've noticed kids will live on bread if you let them. Have you noticed? So I never put bread on the table till the meal was nearly finished. One lady said to me, Barbara, my little 2-year-old, she'll only eat porridge. What'll I do? I said, get rid of the porridge. You'll be surprised what they eat when they're hungry. And you don't make a fuss. You don't say to them, you're never going to eat that again. You'll have World War III. Where's the porridge? Oh, sorry, sweetheart, I forgot to buy it. But I've got this. You don't make a fuss. Remember, digestion doesn't work well when there's a fuss. So down the bottom of the stomach is the pyloric sphincter. And the pyloric sphincter is open when we wake up in the morning. That's why the best time to drink water is as soon as you wake up in the morning, because that's the most dehydrating time of the whole day, is when you wake up in the morning. And when you drink water in the morning, it just goes straight through. But when you come to the breakfast room and you see, smell, anticipate food, the pyloric sphincter shuts and the digestive enzymes are released, ready for breaking down the meal. Now, this pyloric sphincter, it has sensors. And these sensors can tell if that food's broken down. And if it's not broken down to the correct state, this pyloric sphincter stays shut. When it gets broken down to a certain stage, then it opens and little by little the food comes out. And this whole process of digestion takes about 3.5 to 4 hours. Food's starting to come through usually after a couple of hours, but it's not totally emptied for usually 3.5 to 4 hours. Now, obviously, if the person had watermelon, that'd be through maybe in about, hard to guess, maybe 2 hours. But a meal like we had at lunchtime today takes 3.5 to 4 hours, and that's digestion. And then the stomach loves a 1 hour rest. So what that equals is 5 hours between meals. And they're finding this time-restricted eating. I talked about it when I talked about diabetes. Time-restricted eating, which is eating twice, 6 hours apart in a 24-hour. And what they're finding is people are conquering their diabetes. People are losing weight. In fact, even mental problems are improving because the brain's getting this steady, consistent delivery of fuel. And of course, if we run out of fuel, we've got our glycogen stores. Our glycogen stores. And of course, if we run out of them, we've got our fat stores. We've got this amazing backup system. The body ever goes to great lengths to keep us alive and keep us functioning. But if after you've eaten a meal, 2 hours later, something goes in, maybe it's a cookie, maybe it's a croissant, maybe it's a sandwich, maybe the person's really healthy and it's an apple and a handful of nuts. Whatever it is, pyloric sphincter shuts the gate. Shut the gate, something's just come in, it's not broken down. And it will stay shut. And what's happening here is breakfast in this warm environment, it starts to actually ferment. And if there's any meat in there, it'll start to putrefy. Because pyloric sphincter will not open till the newcomer that just came in gets broken down to join this one. Now it can open. And a little bit more goes through. But then it's lunchtime and lunch comes in. Shut the gate, something's just come in, it's not broken down. And that explains why they have done many studies on this, that at the end of the day, 8 hours after breakfast, there can still be remnants of breakfast in the stomach. It's like this. I remember my husband said to me one day, I had a 4-hour job to do today. He said, it's the end of the day and it's still not done. Why? Because he kept getting interrupted. The phone would ring. Someone would come into the office. And that's exactly what happens with digestion. If you keep interrupting digestion, then it can't fully play out. That's why all that should go into the stomach between meals is water. Just water. That makes a very happy stomach. There are some very unhappy stomachs today, and one of the reasons is they believe the princes, because what have the princes been telling people for the last 40 years? We should be eating every 2 hours. That makes no sense. Just imagine I've got some men and they're doing the fencing and I say, you have to come back every 2 hours and have something to eat. How much work are they going to get done? Doesn't make any sense at all. And when my kids started going to work and they discovered morning tea, they said, what's this morning tea? We've got work to do. Everyone goes and sits and has a cup of coffee and a biscuit, or you call it a cookie or a sandwich. My kids are standing around. When are we going to get back to work? Because they had a decent breakfast. They don't need to stop for this sort of stuff. You've heard of the Snowy Mountain scheme in Australia. The Snowy Mountain scheme was where they put in this big hydroelectric system. And they dammed up right up in the Snowy Mountains, which is down the bottom of Australia. And they were building this big Snowy Mountain scheme, it was called. We saw a little DVD or a little documentary on it when the kids were little. But we saw something in there that made us laugh. all the Australians had to stop and have a cup of tea, mid-morning, mid-afternoon. And it was going so slow, they got an American company, you're going to like this story. They got this American company to come over and really get things moving. So it was about 10 o'clock in the morning, the big bosses saying, where are all the workers? Oh, morning tea. They've stopped for morning tea, and they'd have a little fire and they'd have the billy on, because I think this scheme was their 50s, 60s, and a billy is like a little tin thing they put on the fire to make their cups of tea. And apparently the story goes the big boss came up, got his boot, kicked the billy flying and said, "Get back to work." Anyway, he got the Snowy Mountain scheme built. But it was this mid-morning break. Why do they have to stop mid-morning? Because they had a high carbohydrate breakfast that didn't have enough in it, so mid-morning they need more. We're coming down through the pyloric sphincter into the duodenum. The duodenum is the first part of the small intestine, and there's a lot happening in the duodenum. The duodenum is an alkaline environment, because the only part in the whole body that's acid is the stomach. Don't know where that I came from. Duodenum. So look what's happening in the duodenum. We've got the liver, and the liver makes bile. And underneath the liver, we have the gallbladder. And the gallbladder is a reservoir for bile. And I'm so sorry when I hear that someone's had their gallbladder taken out, because there is no need. Did you hear that? There is no need. I'm not in agreement with organs being cut out, because we live in a body that can heal itself. But if your gallbladder has been taken, I'm so sorry to hear that. The good news is you've still got a liver, and it's the liver that makes the bile. So the liver, it releases bile, and bile is the enzyme that emulsifies down to tiny little particles the unsaturated fats. Remember, the saturated fat breakdown began in the mouth, but the unsaturated fats, they start their breakdown way down into the duodenum. We've also got the pancreas, and the pancreas, it releases sodium bicarbonate. Now, the reason the pancreas releases sodium bicarbonate is what's coming out of the stomach is mixed with the hydrochloric acid, so it's quite acid. And so the sodium bicarbonate allows the duodenum to come back to an alkaline environment. The pancreas also releases pancreatic lipase. Lipase is the enzyme that breaks down fat, and lingual lipase was released in the mouth to break down saturated fat, but pancreatic lipase, it further breaks down the unsaturated fats. So bile emulsifies the unsaturated fats into tiny particles, and the pancreatic lipase further breaks it down. The pancreas also releases pancreatic amylase. Now back up in the mouth. In the mouth, the glands underneath the tongue release salivary amylase, which is ptyalin, to begin starch digestion. But within 15 minutes of getting into the stomach, that's put on hold because it's an acid environment. And now it comes down into the duodenum, and with the pancreas releasing sodium bicarbonate, bringing back to alkaline, and with the release of pancreatic amylase, now we get a finalisation of starch digestion. And that's why it's so important to chew. Because if you can get your starch even half broken down, by the time it gets to the duodenum, makes it so much easier for the pancreas. But if it's chew, swallow, swallow, then by the time it gets to the duodenum, and the pancreas looks at this starch that sometimes hasn't even begun the breakdown, that's a lot of work for the pancreas. The pancreas also releases the trypsin brothers. What are the trypsin brothers? I call them the trypsin brothers because there are two of them. There's trypsin and chymotrypsin, so we'll just call them the trypsin brothers. And they finalise protein digestion. Protein digestion began in the stomach under the action of pepsin, but it is finalised in the small intestine, the duodenum, under the action of the trypsin brothers. So let me give you the protein story. This is protein. And when protein gets into the stomach, pepsin breaks protein down to peptides and polypeptides. And then when the peptides and the polypeptides get to the duodenum, the trypsin brothers, they break the peptides down to amino acid and the polypeptides down to peptides and amino acid and the peptides down to amino acids. And it's only in those singular structures can it be absorbed out of the gut and into the blood. But let me give you an illustration of what's happening, unfortunately, a lot today. The person's drinking with their meals, they're eating all day long, they're having their largest meal at the end of the day, and they're stressed out, so hydrochloric acid levels are low. So some undigested protein is getting into the duodenum. And the pancreas says, "What are you doing here?" And protein says, "Sorry, but they're eating all day long, they're drinking with your meals, hydrochloric acid levels low, so they couldn't break down the protein." So the trypsin brothers say, "Well, we'll do the best we can, but all they can do is bring it down to peptide and polypeptide. And that can't be absorbed out of the gut and into the blood. Only amino acids can be." So peptide and polypeptide get into the large colon. You see, all our nutrients should be absorbed halfway down the small intestine. So peptide and polypeptide come into the colon and the colon says, "What are you doing here?" And they say, "Sorry, they're eating all day long, they're drinking with their meals, they're stressed out, hydrochloric acid levels low." Trypsin brothers did the best they could, but they could only bring the protein down to peptide and polypeptide. So the colon says, "All right, we'll do the best we can." So it has to create extra bacteria to try and break this down a little bit. It's not going to get out of the gut and into the blood, but to calm it down a little bit so it's not too toxic. You see, it's been in here a long time. You're looking at 10 yards long here. Dogs 1 yard long. That's why they can eat rotten stuff. And they've got 10 times the hydrochloric acid that we have. Have you seen what they eat? My daughter in Wisconsin, we went outside one day and the smell, and we thought, "What's that?" And we saw the dog had pulled a dead cow leg from the neighbouring farm and it was eating it. They've got 10 times the hydrochloric acid that we have, and their gut is 1 yard long. Ours is 10 yards long. So it's in and out quickly. And if you notice, dogs don't get reflux or heartburn. See, it's not the acid. It's not the acid. So extra bacteria has to be created, and that gives off methane gas. You've heard of methane gas? Wind, is that what they call it? A lot of wind coming out the back end. A lot of it has to do because of the choices made up here. Not chewing properly, drinking with the mouth, eating too often, or the choices we make up here affect the whole of the way down the gastrointestinal tract. But God, in his wisdom and mercy, he puts some enzymes in food that can help break down protein. Proteolytic enzymes, they're called. So a proteolytic enzyme is pepsin. Pepsin's a proteolytic enzyme. Another proteolytic enzyme are the trypsin brothers. Trypsin and chymotrypsin. Trypsin brothers. In the core of the pineapple is bromelain. And bromelain is a proteolytic enzyme. So please, don't throw away the core of the pineapple. So when you eat a pineapple, here's a slice of pineapple. You cut it like this. So everyone gets a lovely fleshy piece of pineapple, but everyone's just getting a tiny little bit of core. Because it's a bit tough to eat a whole core of a pineapple. Tough going. But if you cut your pineapple like that, everyone gets a little bit. And it's easy to chew. There is some bromelain in the skin. It's all right, you don't have to eat the skin. It's a bit tough. But what you can do is when you peel the pineapple, you can chop up the skin and put it with water and simmer it. Simmer it for 10 minutes, let it cool, strain it, and then you can drink a little bit of that before the meal because it'll have bromelain on it, which will help to digest protein. Another thing you can do is with we call it pawpaw, you call it papaya, contains papain. And it's particularly in high amounts in the seeds. We don't advise black pepper because black pepper has an irritating effect on the lining of the gastrointestinal tract. It's a delicate lining. It's almost like the inside of your cheek, your gums. It's very delicate, and the black pepper can irritate that. But what you can do is you can save the seeds of the papaya, wash them, spread them out on a tray, dry them in a dehydrator. When they're totally dry, empty out all the black pepper out of your pepper grinder and discard that. In fact, I was reading another article and it showed that it said every peppercorn they tested had mould in it because as it dries, it moulds very easy. So there's a couple of reasons why we don't use black pepper. But throw them away and then fill up your pepper grinder with the papaya seeds. It looks just like pepper. And grind it on your food. It has a bite to it, and your guest might say, your black pepper tastes a bit different to my black pepper. And just smile sweetly and say, oh yes, it's a digestive aid. That's an easy way to get your papain. Okay, students, a question that I need you to think about before you answer. Which organ of the body is the main organ of digestion? I used to think it was the stomach, but it is not the stomach. What is it? It's the pancreas, which is, yes, the small intestine, that's partly right, but the main organ of digestion is the pancreas, because the pancreas finalises the unsaturated fat, it finalises starch digestion, it finalises protein digestion, and this explains why when someone has pancreatic cancer, they usually die very quickly. In fact, sometimes within a matter of weeks. And they die because of malnutrition, because they can't finalise digestion. And if you can't finalise digestion, the food can't get out of your gut and into the blood. So if someone has pancreatic problems, they need to buy digestive enzymes that contain bromelain and papain and have the digestive enzymes every meal. And that explains why. Now we're coming to the grand finale of digestion. Remember I said if it's not broken down, it can't get out of the gut and into the blood. So where's the grand finale of digestion? It's the small intestine. The small intestine is lined with villi. Up the middle of the villi is the lacteal, which is part of the lymphatic system. And all through the villi is a blood capillary network. And that blood capillary network, of course, is what we're wanting to get our nutrients into. because it gets out of the gut, into the blood, and then the blood carries the nutrients to the inside workings of the cell. That's why the title of this lecture is Gut Health and Chronic Fatigue Syndrome. Because if your cells aren't getting the nutrients or the oxygen, the person can be very fatigued. Lining the gastrointestinal tract is a thick turf wall. This thick turf wall, Dr. Natasha Campbell-McBride, in her book Gut and Psychology, she calls this a thick turf wall. And I think it's a nice illustration. It's like the grass covering the earth. And that thick turf wall is made up of Lactobacillus acidophilus bifidus bacterium. In fact, from those two permanent bacteria, all the others are made. You've probably seen names of them, these great big long names, but they all basically are generated from Lactobacillus acidophilus and bifidus bacterium. It's called our microbiome or our gut flora. And when we were in our mother's womb, our gut was sterile. No, none of that microbiome was there. But when we were born, we were literally showered with our mother's microorganisms. And breast milk doesn't come in for 3 days. That first 3 days, there's a thick colostrum coming from the breast, and that is rich in microbiome. And 70% of our immune system is established by our microbiome. It's very, very important. And that microbiome, it accomplishes the final steps of digestion. That microbiome, it releases nutrients. So it's responsible for the final breakdown of certain nutrients. As we saw, all of these enzymes are breaking our food down, but the microbiome are responsible for the release of our B vitamins. This microbiome is responsible for the production of melatonin, and melatonin is called the fix and rejuvenate nighttime hormone. But also glutathione. Glutathione is considered the most potent antioxidant. And it's not actually found in food, it's a release from our gut flora. Hippocrates said all disease begins in the gut. And he didn't know the fine details of what I'm showing you here. So this microbiome is essential for the release of these nutrients. It also is responsible for the absorption of our nutrients out of the gut and into the blood. It protects the blood against any harmful pathogens that might be in the gut. This microbiome also plays the role of nourishment to the cells that line the gastrointestinal tract. How important is our microbiome? Unfortunately today, there are some lifestyle practices that are breaking down our gut flora. Antibiotics. One writer said, and taking an antibiotic is like dropping an atomic bomb in the gut. What did the atomic bomb kill? The good and the bad alike. Yes, it'll kill off harmful bacteria, but it'll also kill the good. Remember? Drugs are like robots. Get out of my way, I've got a job to do, just kill, blast, blast, blast. Also, statin drugs. They're your cholesterol-lowering medication. Tomorrow, when we talk about the heart, you'll discover there is absolutely no need to take statin drugs. Also, long-term painkiller use. Long-term painkiller use kills off the microbiome. What else kills off the microbiome? Well, refined sugar feeds the yeast in the gut. So you put the refined sugar on top of that and you get what in these little sections here, we've now lost our final breakdown. We've now lost the ability to release these essential nutrients. We've lost the ability to properly absorb out of the gut and into the blood. We've lost our protection so harmful pathogens can get into the blood, and the cells that line the gastrointestinal tract have lost their nourishment, and they can even start to break down a little bit. You've probably heard it, it's called leaky gut. People hear of leaky gut, but they don't quite know what it is. But the cells that line the gastrointestinal tract are remade every 3 to 5 days, so this situation can be healed very quickly. If someone has ever been on antibiotics, they need to go on a probiotic every morning, 3/4 of an hour before breakfast, for at least 2 months. Plus, they can include in their diet probiotic foods. So probiotic foods are sauerkraut, yogurts, and you can get very nice plant yogurts today. You can get coconut yogurt, you can get cashew yogurt, you can get almond yogurt. Also kimchi, kombucha, these are all cultured products that help to boost our microbiome. So halfway down our small intestine, our nutrients are all absorbed. All that's left now is insoluble fibre. And insoluble fibre is very important. In fact, what's coming out of the small intestine into the large, and there's a double-layered valve there called the ileocecal valve. And it's there to stop anything from the colon going back into the small intestine. We don't want that. But what's coming out of here is mostly liquid, and one of the main functions of the colon is to take water out so stools are formed. But before we move on to the colon, I'd like to mention the appendix. You know God doesn't make mistakes, don't you? God is a God of perfection. The appendix has 2 important roles. One role is that it is the colon's oil can, so it lubricates the contents of the colon so it can be released with greater ease. But it also releases antibacterial fluid, so that if what's coming out of the small intestine is toxic, it releases it. Remember, the dog can eat rotten food, it can eat a high meat diet. You see, all animal products, when they break down, they putrefy, and the putrefaction process gives off toxic fumes. So if someone is eating a high meat diet and there's no fibre in the diet, meat has no fibre, then there can be a slow transit. Dr. Kellogg said 3 intakes of food a day should equal 3 evacuations a day. But I have met some people that have come to our retreat, they go once a week. Or they go once every 2 days or once every 3 days. Whew, what's coming out of here is pretty toxic. And then the poor old pancreas has to work very hard, very hard. And that's one of the causes of appendicitis, is the poor old appendix is just overworked. So insoluble fibre is very important, and all plant foods have insoluble fibre. And that insoluble fibre sweeps the colon, it stimulates peristalsis through the colon, but it does something else. Different fibres feed different microorganisms. Let me give you an illustration. You can have 10 different types of apple, and every different type of apple will feed a different microorganism. So the more variety we have in fibre, the more we're establishing and maintaining our gut flora. And our gut flora is vital. There's one thing, and only one thing, that all the experts agreed on in 2020, that we need to boost our immune system. Is that right? And one way to boost our immune system is to have a lot of fruits and vegetables, a lot of variety. We had a beautiful variety at lunchtime today, didn't we? So I think we would have had easily 10 or 11 different types of fibre if you look at the olives and the tomato and the carrot and the cucumber and, weren't those plantains? Very, very nice. And we had cabbage and bean and rice. I think there was about 10. In fact, when I was in Andalusia, Spain, I was speaking at a homeschool camp. So there's a lot of kids there. And I was talking about counting your fibre, kids. Try and get as much fibre as you can. So the next day I said, okay, kids, how much fibre do you have for breakfast? And this 10-year-old boy says, 20. I said, 20? And I looked at his father, and his father went, I think he had a blueberry and a blackberry and a strawberry, and he was going to get that fibre up. So the more variety of fibre you have, the more you're establishing your microbiome, which is, again, the establishment of our immune system, which is, of course, vital. So what does the colon need for it to be moved daily? Because if you notice that your colon has a mind of its own, if you tell it to go, it won't, and if you tell it to stop, it won't. It needs gentle stimulation. What gently stimulates it? You know, the merry heart doeth good like a medicine, says the Proverbs. We should laugh more. Children laugh 125 times a day, so should we. So laughter is good medicine. Laughter relaxes the colon. And that Proverbs is 17:22. What also is needed for a well-running colon is fibre. So increase that plant fibre. What's also important is exercise, because when you exercise, you gently massage the colon, and when you exercise, you increase blood supply to the colon. One of the best exercises for the colon is your core strengthening exercises. They're your Pilates type exercises. What also the colon needs is water. One of the main functions of the colon is to take water out so stools are formed. So if too much water is taken out, then we're left with rabbit pellets and cement. And unfortunately, the caffeinated drinks, whether they be Cokes or Dr. Peppers or teas or coffees, they are full of dehydrating agents. So they do not hydrate. But what's also important is position. So what do I mean by position? Let me illustrate. So here is the throne, and here is a person sitting doing their daily evacuation on the throne. Now notice at the end of the colon there's a little red, well, I've drawn it as red, and it's a muscle. And it's called puborectalis, and that muscle holds up the last part of the large intestine, and we are so thankful for that muscle, because you're in a traffic jam and you need to go, you have to hold it, because you can't go. And if the plane's about to land and you need to go, you can hold it, all because of puborectalis. But unfortunately, many people use that because they're washing the car and they don't want to stop. But they could. They're busy in the kitchen and they don't want to stop till they got the dish in the oven, but they could go. Or they're on the phone to a friend and they don't want to finish the phone call until don't want to go till they've finished the phone call. Or they're watching something on, we know it well. If you feel to go, it's important to promptly answer nature's immediate call. Got that? Panic if you don't. Because when the body says go and you don't go, it's because of pressure on the anus, because this is starting to fill up. If you don't go when the body says go, that all will fall back into the last part of the colon because it can't stay there. The body goes to great lengths to protect us. It can't stay there or it'll weaken the area, and you don't want that area to be weakened. You want to have total control there. So please, if the body says go, go. One lady said to me, I'm a consultant. If I'm on the phone and I need to go, she said, people pay hundreds of dollars to speak to me. If I'm on the phone and I need to go, she said that she says to them, excuse me, a crisis has arisen, I'll ring you back. And she goes. The problem is, it's not the odd day when you're in a traffic jam or the plane's about to land. It's not the odd day you might use that. And it's not the odd day you don't. It's what you do every day. And what often happens is then a habit arises, and it's a big contributing factor to constipation. But when the person is sitting on the throne to do their daily evacuation, this muscle is still taut. But we know things can get through. But if the person is sitting on the throne and in front of the throne is a little stool, causing their knees to be up in the air, mimicking the squatting position, then puborectalis relaxes. Puborectalis relaxes in the squatting position. And when puborectalis relaxes, then the colon opens wide and the contents pass with the greatest of ease. So this person is a very happy person because their daily evacuation happens with the greatest of ease. This one's not very happy. And if this person hasn't been for a couple of days and they decided to use a bit of pressure to push things along, all that happens is a lot of pressure is put on that anus, and when a lot of pressure is put on that anus, something has to give, and that's when hemorrhoids happen. We don't want that. We're going to rub them out straight away because they're nasty little things. When I worked in the operating theatre, we did a few hemorrhoidectomies. And all they do is put a stitch around the base and cut it with a pair of scissors. How's that person going to feel when they wake up? Talk about torture. Nothing compared to how they're going to feel when they do their first evacuation. I'm sure they're not told to squat, because if they were told to squat, it would take a lot of pressure off that anus. So if someone has hemorrhoids, you can go to Bed Bath Beyond and buy a squatty potty. And it's very civilised. It sits around the toilet. I've been in many countries, and particularly in the Asian countries, still today, you go into the bathroom and it's a hole on the ground. It's all flush, but you squat. And if you can't squat, you're in trouble. That's why it's important to keep fit and be able to squat every day. Do you do them every day? The only reason I can do that with ease is because I learnt to do it in pregnancy. And my last baby, I squatted all the time. The baby flew out of me with one push with the bag intact. Well, that squatting really prepares you. But I could not squat. So what I did was I just put my back against the wall with my feet flat, and I just did that for 10 minutes a day. And then eventually I got to the point, so my last baby's 38 now, so I've been able to squat with ease for the last 38 years. Now, if I stopped squatting when I gave birth to my baby, I wouldn't be able to do it with ease now. But what gets me up again after the squat is my quads. And your quads are the biggest muscle mass, your femur's the biggest bone, and that's what we should be lifting with. You know how a baby picks up a ball, 2-year-old? They pick the ball up like that. Because God made the biggest strain to go there, not there. How many adults pick up the ball like that? That puts all the strain here. So you've got to protect your back, because a sore back is no fun. So you protect your back by strengthening your quads. So if Jacqueline's not around and I'm at the airport and my big bags, because I've got to have 4 seasons, different outfits every day, I've got a big bag. Can't find anyone around. I look for a strong young man, still can't find anyone. So I think, right, I've got to do it. You know what I do? I prepare myself. I bend my legs. I engage my core. I grab the handle and because I've got to protect this back. Who else is going to protect it? That's why we're the doctor. We've got to look after this. A sore back is no fun at all. So these positions can be very helpful to overcome colon problems and also to heal from hemorrhoids and to prevent hemorrhoids. So what if you're doing everything right? What if you're having high fibre? What if you are relaxing? What if you are exercising, you're drinking all your water, and it still doesn't go every day? We are creatures of habit, and our cells are creatures of habit. Even our colon is a creature of habit. So I'm going to tell you the story of a lady that came to our retreat. She was a psychologist. She was in her 60s, and she went once a week with help. I said, we'll get you going. So what we did, we gave her a mix, and it's in my book. It's called colon tea. And I know Living Springs, you sell it, don't you? The colon tea. And this colon tea has a mix of herbs. One is cascara. That's a very strong and a very bitter herb, but only a small amount of cascara is in there. Licorice is a very sweet herb, but it has an emollient or gentle effect on the colon. And the last one is buckthorn. Buckthorn is a relative of the cascara, and buckthorn and cascara are both barks. Licorice is a root. So I know Living Springs, they mix it up in mix. It's already mixed. So what you do is you take a teaspoon of that, put it in a cup of water, and gently simmer it. Wherever you've got bark and roots, you need a gentle simmer. So we gave this tea to the lady in the evening. She hadn't gone in the morning, so we gave her another cup of tea in the middle of the day. Still hadn't gone. We gave her another cup of tea in the evening, and then the next morning she went. And she came out in the morning with the biggest smile on her face. She said, wow, that stuff's good. We also put a castor oil compress on her abdomen, and that penetrates deep and can help to break up. She learnt about the basic laws of health. She started to eat plants. She stopped her coffee and her red wine at night. She went on plants, stopped the meats. And she got back to me 4 months later, 4.5 months later. She said, I had to take 3 cups a day. She had to take 3 cups a day. That got her going twice a day. But by the way, by the end of the week, the whites of her eyes were white. Her skin went from grey to pink. Her whole body was being affected because of this retaining of the waste in her body. In fact, at the end of the week, she said, I can't believe how clear my mind is. Maybe this is the problem with most of my patients. What was she? A psychologist? Colon not working well? The mind and the colon are closely connected. Anyway, she got back to me 4.5 months later. She said, for the first, I think it was 4 weeks, she had to have 3 cups a day, and that got her going twice a day. She said after about 6 weeks, she said, I started going 4 times a day, so I brought it back to 2 cups a day. She said, after about another month, I started going 4 times a day. So she said, I brought it back to 1 cup a day. She said, after another 6 weeks, I started going 4 times a day, so I stopped the tea. She said, I just have to tell you, I'm so excited. All my life I've struggled with this. It only took 4 months. But what those herbs did is they revived and restored colon function. At first she had to take it every day, but eventually she retrained her colon. And she is such a happy lady now, because she used to take this toxic medicine once a week that caused her to have this flush out. And she said she couldn't go to work that day. And her colon was so sore the next day. And then she'd go another week without going. She had this vicious cycle. She said, I just came to the health retreat for a rest. She said, I had no idea that I would learn how to get my evacuating system working well. But what about the other end of the scale? And that is gastritis, Crohn's disease, colitis, irritable bowel syndrome. I put them all together because they are all irritations of the gastrointestinal tract. And we are told that Crohn's disease is an autoimmune disease. Am I right? Well, I have to tell you right now, I don't believe in autoimmune diseases. Because the body was designed to eat itself. It wasn't, to heal itself. It was not designed to eat itself. And isn't that what we're told, an autoimmune disease? So if you're told you've got an autoimmune disease, please reject that immediately. Reject it. because I've seen people conquer rheumatoid arthritis. We're told that's an autoimmune disease. I've seen people conquer thyroid problems, and we're told that's an autoimmune disease. I've seen people conquer Crohn's disease, and we're told that's an autoimmune disease. And that's why I say I don't believe in them. I believe that you've got symptoms, but there's no need to take the title. We've been given one title, only one title, and that's found in 3 John chapter 1. So it's 3 John, the first chapter. It says, "Behold, what manner of love the Father has given unto us, that we should be called the sons and daughters of God." That's our only title. So don't take on any other title. How many people are given a title, and you know what the body says? Looks like this is what we've got. And the whole body starts to live up to that title. No, reject it. So how does someone conquer Crohn's disease, colitis, irritable bowel syndrome? In fact, even ulcerative colitis. They've got to stop something that has a very irritating effect on an inflamed colon. And that's the 5 allergens. Dairy. I do appreciate that some people are 5th-generation dairy farmers, and they're eating the raw milk out of the cow, and they're doing very well. I acknowledge that. But if someone's got irritation of the gastrointestinal tract, I've got a lady who's looking up the Bible verse for me, and she's going to check for me if I got it right. Did I get it right? 3 John? That's right. I think it's 3 John. It's just such a lovely promise that, behold, what manner of love the Father's given unto us. Okay, we'll get back to that. Dairy. So if someone has irritation of the gastrointestinal tract, the dairy must stop. I'm a 5th-generation Australian Scottish descent, so I've never been able to handle dairy, even raw organic cow's milk. Sorry, I can't handle it, so it's not in my heritage. Wheat, and we saw this morning that they've changed the wheat. They've changed the wheat. Can you still get the original wheat? You can. It's called Enkenhorn, also spelt, and Emmer, E-M-M-E-R. I had it written up on a board. Someone asked me that earlier. You can. They're called ancient grains because they have not been hybridized. So Enkenhorn. And Emma. So Emma and spelt are wild or field hybrids of the original Enkenhorn. But they're called ancient grains. They're called ancient grains because they haven't been hybridized. That's the original wheat. Now, they do still have a little bit of gluten in them. Gluten is the protein in the grain. So if someone's celiac, they can't even handle that. But if someone's gluten sensitive, they can usually handle that. But there is a beautiful bread. It's a sourdough gluten-free, and it's called Simple Needs. And the Needs is K-N-E-A-D-S. You can Google Simple Needs and see them. So when I travel, they just get me to tell them everywhere I'm going to be. So this is my 10th week in the US of travelling, giving meetings, and everywhere I go, they send me the bread. In fact, most gluten-free bread's pretty bad, but this is amazing. It's very, very nice. Got that totally wrong, didn't I? 1 John 3:1. Yeah, I got the 3 in there in the wrong place. Behold, what manner of love the Father's given unto us, that we should be called sons and daughters of God. So Simple Needs is the bread, and I know that you can get it in, I think you can get it in Whole Foods. I think you get it in Sprouts. I love supporting local industry, and I know the family. It's mum and dad and 5 little kids, and it's their own company, but it's very nice bread. So wheat was hybridised in the 1950s, and in that hybridisation process it created a very complex protein or gluten structure, and that's very difficult for the gut to break down. So if the gut is inflamed, it's like kerosene on a fire throwing that in there. Oats, or you call it oatmeal. Oatmeal is high in a plant chemical called lectins, and if lectins get into the blood, it has an inflammatory effect. So my 3 sons, they eat oats for breakfast every single morning. They love them, they do well with them. But if someone has inflammation of the gastrointestinal tract, that is one of the common allergens. Peanuts are commonly contaminated with mould. We touched on that yesterday when we looked at Colin Campbell and his discovery of aflatoxin in the peanut butter. But if you love peanut butter, I've got some good news. You can use cashew butter, you can use almond butter. Peanuts are particularly susceptible to mould because they're grown in the ground. They're actually not a nut, they're a legume. And refined sugar, again, that's just a pure acid, so that's highly inflammatory in any area of inflammation. So when someone has irritable bowel, those foods must stop. And I've had people tell me that it was a surprise to know that. Because doctors don't study nutrition, Walt Cross told us last night how much time do they spend on nutrition, and apparently it's an elective. In other words, not every doctor even studies that. But there is a herb, remember Psalm 104 verse 14, that God gave herbs for the service of man, slippery elm. And in some countries where I go and I talk about this, they can't even get slippery elm. But here in the America, it's an American tree. It's the powdered bark of the slippery elm tree. It's like a fluffy powder, and when you put hot water with it and mix it, it goes like a soft jelly. The more water you put in, the more liquid it gets. But slippery elm has a growth stimulant, and it stimulates rapid healing in the lining of the gut. Slippery elm coats and it soothes and it heals the lining of the gut. If someone's got diarrhea 10 times a day, they might take a dose of that every hour. And then as it settles down, they can back off a little bit. Remember, part of being your own doctor is listening. The cells that line the gastrointestinal tract are remade every 3 to 5 days. So once given the right conditions, the response happens quite quickly. So we had a young man from Kenya attend our program, and he had ulcerative colitis. So that's where the lining of his colon is even ulcerated now. And he had terrible diarrhea. And he was on anti-inflammatories, and he was on cortisone. He was on 20 milligrams of cortisone a day. And this was his favourite food. That's almost what he lived on. So, of course, at the retreat, we didn't serve any of that. And so because his diarrhea was so bad, we gave him the slippery elm about every 2 hours. And he was a very private man, because I think in his culture, you don't talk about this. So every day, in fact, on the Tuesday, I went to him and I said, "How are things?" And he'd just go, "Good." That's all I'd get. And I took that, wow, well, that's really good. So after 48 hours, I wanted to know a little bit more. And I said, "How are things?" And he just said, "Good." I said, "Are you getting any bleeding?" He said, "No, it stopped." I said, "Are you getting any cramping?" He said, "No, it stopped." That's remarkable. And then I pushed it a little bit more. I said, "How many times are you going?" And it was almost like 4. That's from, I think it was 8, 9 times a day. But it was hard to get any information out of him because He was just so private about it, but we really wanted to help him. So by Wednesday, so we're getting to the end of the third day, 3.5 days he's been with us. So we brought the slippery elm back to four times a day. So before breakfast, before lunch, and before broth, and then just before bed. So it's coating and soothing while he sleeps. And so I pushed the questions a bit more, and he was just very happy. And I said, I can't tell you what to do with your medication, but I can tell you what I do. The fact that there's no bleeding, the fact that there's no cramping, the fact that the stools are even starting to form was very hard to get that information out of him. I said, if I were you, I would stop the anti-inflammatories. I said, don't stop the cortisone. We're going to have to go very slowly on that one. He nodded. So the next day I said, how are things? And he just said, as usual, good. I said, did you stop the medication? He said, I did. I said, and everything's still good? Yes. That's about all I could get out of him. I thought, wow. Now, if he'd started diarrhea again, you got a choice. You can go back on, I'd go back on half dose, or don't go back on it, just go on to slippery elm every hour. So even if the diarrhea came back, we can manage that. But it didn't. The fact that he wasn't bleeding, the fact that he wasn't cramping, they were signs that the inflammation was settling. Even the ulcers were healing because he didn't have the pain. So I've got to listen. Listen to what your body tells you. And even when you go, have a little look, because what you see in there, well, is an indication of what's happening in here. It shouldn't be the colour of custard and shouldn't be the colour of charcoal. It should be like a mid-brown, because even the colour and the form. It shouldn't be liquid. It shouldn't be rabbit pellets. It should be like sausages. Sorry, I don't know how else to explain it. And it should float, because floating says there's good bacteria in there. So part of being your own doctor is assessing your body symptoms. I said to him at the end of the week, his wife came and it was a lot easier. She talked a lot more freely. and he'd talk to her and then she'd talk to me. And he was so excited because he's 40 and for 20 years he'd suffered this. And in 1 week he saw more improvement than he'd seen in 20 years. Because all the doctor had was more medication or up the cortisone or start cutting the colon out. And I've had people come to our retreat, their whole colon has been cut out. And what they've done is they've joined the small intestine to the end. And yet we live in a body that's got an inbuilt ability to heal itself. You've just got to give it the right conditions. And your body's response will say this to you, I like it. Or it'll go, don't do that again. Or it'll say, we're going to do that a little bit longer. But it's important to listen. So with the cortisone, I said, this is what I do. You can go to your doctor. You can tell him of what you're doing. You can tell him of what your body's doing now. And hopefully he'll work with you. Some doctors will, no doubt. Because a good doctor just wants you better, right? And usually you can drop 5 milligrams of cortisone once a month. You've got to do it very slowly, because if you stop it, you'll get a major inflammatory response. So you've got to go off it very slowly. And so some of our guests have told us they drop 5 milligrams a month. So within 4 months, they were off all the cortisones. And some of these are people who were told they'd be on it for the rest of their life. But I have mercy on the physicians. They're just telling you what they know, and they don't study nutrition. But remember what God designed. He designed each one of us to be our own doctors. And it's observing our body's response. Unfortunately, today we're all raised to give our health over to the doctor with the pink pill. And how many people now are going to the naturopath with the green pill? But what we've got to get back to is giving our body the right conditions and listening it. And maybe the green pill will help a little bit with a few areas, especially if it's herbs. But those sustain me principles, as it says in the book, The Ministry of Healing, page 127, these are the true remedies. So that's always the foundation of no matter what the problem. You've got to go to bed early, you've got to start drinking more water, you've got to get rid of the stimulants, you've got to start eating a plant-based diet, etc. It's like exercising the body. They're the basics. They're the basics. So we have seen many people heal from all manner of diseases, even ones they were told would never heal from. And if ever you're told that, you know what you say to yourself? Well, I'm going to take great pleasure in showing him that I can. And Jack and I have been talking about getting some medals for people who've actually conquered it, because that is remarkable, especially when you're told you'll never heal. Remember the little old lady that said, "You're not God, only he knows." So now we're down to the very end, and there are some things that you can do to get relief from hemorrhoids. There's one essential oil mix. It's called Peace Please. I think it's a very appropriate name. And I know Jacqueline's shop in OK Be Healthy, she sells Peace Please. Actually, Jacqueline's shop also sells the colon tea and the digestive tea. Peace Please is an essential oil mix that a couple, they're good friends of mine, and they're only young, even now they're just in their 30s, but the lady had hemorrhoids from her babies, and the man had a genetic weakness in his anus, where part of the colon would come out, even though he eats well. And they found, well, they put it together themselves, this Peace Please essential oil mix. It brings great relief, even to the point of contributing to the healing of hemorrhoids. So I know that Jack's OK Be Healthy sells that. But you can also make a suppository, and inserting this suppository at night brings relief. And you make it with 50% castor oil. So castor oil is a great healer. It penetrates very deep. But to insert it in the anus, you need the suppository to be solid. So you can do 50% castor oil, 50% coconut. And when you put it in the fridge, or if you want to make it quickly, you can put it in the freezer. But first of all, you melt the coconut oil and you mix it with the castor oil, and you get some disposable gloves, and you fill the disposable fingers with the oil, and then you seal it off, maybe with a bit of tape or cotton, and then you put that in the freezer. In our freezer at Misty Mountain Health Retreat, there's lots of fingers. And then once it's solid, you cut one of the fingers, peel the plastic off, and you insert that, and you would insert it up until it's probably like about there, and the heat from your body will melt the coconut oil, and the castor oil, it disperses out. And then the next day, when you do your daily evacuation, of course, it will come away. Well, it's got one of the beauties of this little packet. I think it's 1 or 2 drops. They will tell you there's a brochure in there, and it talks about different positions when you do your daily evacuation. It talks about building different muscles, because the guy is a massage therapist. He knows his muscles very well. So it's not just the essential oil you'll get a lovely little directions on how to heal from the hemorrhoids. Jacqueline sells it at OK Be Healthy. It's called Peace Please. With irritable bowel, with Crohn's disease and also with constipation, castoral compresses on the abdomen can be very helpful too. So we had a guest, she was the wife of a doctor, and she said, I had irritable bowel very badly. And when I talked to my husband about what he would do, I did not like it. So she said, I Googled and I discovered castoral compresses. She said, I healed my irritable bowel with castoral compresses. Castoral penetrates very deep. So if you've got constipation, it'll help to break it up and soften it. If you've got irritable bowel, it'll penetrate deep and it'll ease and soothe the area. And if you've ever had operations in your abdominal area and there's leftover scar tissue, that'll help to break up the scar tissue.